In news from Jamaica, Health Minister Dr. Fenton Ferguson is promising to have further consultations with public health workers before introducing flexi-work arrangements in the health sector. Quelling what seemed to be a looming crisis in the sector, on Friday, doctors threatened industrial action if the government refused to scrap the proposed flexi-work schedule. The new work arrangements are expected to come into effect on July 1. However, President of the Jamaica Medical Doctors Association, JMDA, Dr. Alfred Dawes, said members are against the move. He noted that recommendations from health practitioners were ignored by the task force set up to examine the work arrangement. However, speaking in Parliament on Tuesday, Dr. Ferguson says no decision will be made without proper dialogue. He also announced that a comprehensive audit will be conducted at major hospitals to understand the challenges being faced.
Mr. Speaker, I've already asked the chairman of the boards of the regional health authorities to conduct a comprehensive audit of their major hospitals and health centers to determine the availability of supplies and the challenges being faced in ensuring adequate supply chain management, the results of which will be addressed through the additional resources provided for pharmaceuticals and sundries in this financial year's budget. Mr. Speaker, the task force established to examine the delivery of medical care, including the way our doctors practice, will continue to meet, and we look forward to reviewing the recommendations. We are also looking forward to the re-engagement of the JMDA in this process. In the meantime, Mr. Speaker, there will be no implementation of a shift system until we have successfully completed the work of the task force.
In the meantime, Dr. Ferguson says there is a greater thrust to improve primary health care. He notes that a number of health clinics will be upgraded shortly, especially those in rural Jamaica.
We plan to undergo work at Granger Health Center in Westmoreland, Comprehensive Health Center in St. Andrew, Maxfield Park Health Center, Christian Penn in St. Catherine, Runaway Bay in St. Anne will receive brand new clinics. Buff Bay Health Center in Portland, we will turn some attention to Buff Bay this year, Member of Parliament. Good work. Design work for a new health center in Port Maria and expansion work for the Stony Hill Health Center will also begin. Focus will also be placed on funding options, Mr. Speaker, for a new health center in Old Harbour, St. Catherine, given the population and the